These are the top 10 reasons for chronic pain after a knee replacement. And reason number one starts right after the surgery. It's really, really important to get your knee straight right after the surgery. Most people are very, very focused on getting that knee to bend. And that will come with time if you're doing your rehabilitation properly. But if you don't get that knee straight really, really quickly, ideally within the first few days afterwards, it becomes much, much, much harder to get on the back end. And if you can't straighten your knee fully, you're going to have a much harder time walking properly. So that's tip number one, get your knee straight.
The next tip is to make sure you get better glute strength as fast as possible. Right after a knee replacement, you're going to have to focus on getting quad strength right here on the front of your thighs, but that tends to come fairly quickly. The very next step is to get enough glute strength back here so that you can have a good balance of muscle strength around your hip and knee, because that's going to set you up for better movement as you progress.
And if you don't know us already, I'm Dr. Dave Candy. I'm an orthopedic manual physical therapist.
My name's Dr. David. I'm a manual physical therapist as well, and I'm actually visiting Dr. Dave here in St. Louis. We're at a manual therapy conference. I've got a channel called El Paso Manual Physical Therapy, and he asked me to join him on this video today.
So tip number three is stiff calves. If you have stiff calves, then you won't be able to progress your body weight forwards when you're taking a step. And if you can't get your body weight out in front of you, it makes it really hard to walk properly. Now, fortunately, your body has lots of different compensation mechanisms to allow you to compensate, but one of them is twisting your knee inwards to get around your foot. And that causes stress on your inner knee, which can create inner knee pain. Even though you've had the joint replaced, they don't replace the muscles and tendons, and that twisting inwards or overpronation of your foot can create pain on the inside of the knee after a knee replacement.
And the next tip related to the knee falling inwards, like Dr. Dave was just saying, is it can cause pain at the hip and pain in the foot, because that's just not the way that the knee was designed to move. It's not a normal movement pattern, but it tends to be a way that people move after having a knee replacement, where their knees collapse inwards and of course causing the inner knee pain. It can cause pain in the hip and the foot that just persists and can become chronic as the months and even years go by after having a knee replacement.
And many people do let too many months and too many years go by just thinking that it's normal or it'll get better. But if it hasn't gotten better with your initial rehabilitation, chances are it's not going to get better unless you do something different about it. So the next thing that can cause chronic knee pain is a muscle on the inside of your leg, or rather three muscles that attach on the inner side of your knee. Often those will come from that same movement pattern that we just talked about. But those three muscles, they attach right on the inner side of your shin. And so if you feel like you have some knee pain that's not really in the knee, but slightly below and on the inner side, that may be a cause of your knee pain.
There's also a nerve that runs through the area. It's called the saphenous nerve. That nerve is a branch off a big nerve on the front of the thigh called the femoral nerve. But what's interesting about that saphenous nerve is it comes down into your lower leg, but there's a branch that wraps around the front of your knee. And when the surgery is performed, the knee replacement surgery, the surgeon must cut through that nerve in order to access the knee and do their work, do the operation. Well, after the knee replacement, sometimes or oftentimes, the nerve doesn't heal properly. Most people will have like a numbness sensation on the front of their knee, but some end up with chronic pain because the nerve just didn't heal right. It didn't get happy afterwards. So that could be a reason for pain as well.
Another reason is improper nutrition, that you literally are what you eat. And if you're not giving your body the proteins that it needs to rebuild after a surgery, or if you're not giving your body the nutrients that it needs to have the energy to rebuild after a surgery, then you're going to continue to have chronic pain. So getting proper nutrition is very important after a knee replacement.
Just to take a quick break from the tips, we'll give you all the rest of them so we get 10 in. I just want to let you know I've got a program called the Failed Knee Replacement Recovery Program. This is a comprehensive program that you can purchase so that you can get help if you've had a knee replacement already and you're still dealing with chronic problems and you're done seeing your doctor, your surgeon for follow-up visits, you're done with physical therapy, they've just kind of left you on your own, and even though you're still having some pain, you're looking for ways to get the most out of your knee replacement so that you're not having to have a second knee replacement or revision, and so that you can live your life and be as active as possible. If you want to learn more about that program, check out the link below to get more information. The next tip is weakness in foot muscles. A lot of people don't pay attention to the strength of the foot muscles, especially the muscles that make you curl your toes. When you have better strength in your toe curling muscles, it helps to set up the position of your knee and the forces going through your knee. So using your toes properly when you walk and just having good strength in there is a big deal to set you up to have a good foundation for the knee and the hip and the back.
And another reason that people continue to have chronic pain after knee replacement, this is one people really don't like to talk about because it goes in here instead of out here. But the top predictors of chronic pain 1 and 5 years after a knee replacement are actually anxiety and depression. And it doesn't mean that the pain is in your head, but if you're more anxious or depressed, it makes your nerves a little bit more sensitive, and so that they register the signals coming from your knee at a higher level. And so talking to your doctor or a counselor or a pastor or someone you can trust to get your anxiety levels down, ideally before surgery, but afterwards if it's too late for that, that can help you to perceive the signals coming from your knee less.
And the last tip is having stiffness in the quad muscles right here on the front of the thigh. Oftentimes, when these muscles get too stiff, they become that way because they become overused, maybe over-exercised in the rehabilitation. And simply massaging out the muscle can allow the knee to bend better, for the leg to operate better. It can just help out with chronic knee pain after knee replacement tremendously.
So those were the 10 tips. Hopefully you did find those helpful. And again, Dr. David's got that program if you do need some more in-depth help. So thank you for joining us on this video. And if you did find it helpful, give it a like and subscribe to the channel so you can get notified of our future videos.
See you next time.